So, for expectations for post op care for Mr. D, who just had hip surgery on his left hip, he has an IV in his right arm, and he has a Foley catheter. Um, Post op, like initially routine, is the nurse will check the bandages for any fluids, like blood or any discharge that is colored or unnormal, and document pain levels using a pain scale, and anything that they say you would document word for word. The patient themselves, you would document word for word. And you would have, what's it called? Oh my goodness. Oh, post-op. So what the CNA would do would, we would help the nurse transfer the patient onto their bed from the stretcher, and the nurse might order us to check their vital signs. So you'd have to do that for the given time. So every 15 minutes for, I believe it's the first hour, and on and on. And then for pain control, CNAs cannot give medication, but we can help them get more comfortable if it's repositioning to their specified needs. So obviously with a hip surgery, you can't have them lay on their affected side. So you would tell the nurse, you would document, again, word for word, what they're telling you, how it feels, and then the nurse could give them the medication if that's what they need. For IV concerns, since we can't take it out or anything, we can just check it to make sure if it's looking normal or if it's looking red and irritated, and they can tell you if it hurts or not. And you would again document that for word and tell the nurse. For wound dressing, we as CNAs can't do that, but we can check to see if it has bled through or if there is discharge that shouldn't be there, and we can differentiate what's normal and what's not and document that. And if it's something that's not right and is emergent, tell the nurse immediately. And for tubes and drains, we would have the suction for drainage, and make sure that since he does have a Foley catheter, make sure it's full, and if it is, you can drain it. If not, you can leave it. And if the doctor orders intake and output, you can keep it that way for output through the drainage bags. And make sure that the sites where the tubes and drains are put in are clear, are clean, and if they're infected or they're painful, report that to the nurse. For the abductor pillow, you would use that to make sure that their legs and hips are not just straight, so they don't lose their flexibility, and it helps with range of motion, so it's not stiff. And then when they start walking and doing their exercises, it'll be easier for them later, and it's not going to hurt as bad because they've been working with their hip and their leg from the start. For Foley catheter care, we can't take it out or put it in, but we can check to make sure it's how it's supposed to be, and it's clean and it's not painful, even though it might be uncomfortable, and report any of that to the nurse word for word if they tell you anything. And for documentation, you would document any changes, and if it's positive or negative, and you would document word for word what the patient says. And if it's just something from what you're looking at, you write exactly what you see, not you think. So if they have a bruise on their arm, you don't say, I think it's from someone grabbing them. You ask the patient or resident what happened, and if they don't know, you write exactly what they say, and then you also document what it looks like to you. So if in a circle and it's bruised, and you would say what color it is, if it's raised, and the shape it is, and like size if you can try to measure that as well.